Fox 5 New York, this is Good Day New York.
We all have problem areas.
Really? Not
One,
me.
2, 3.
I've lost count.
Wishing we could just melt away the fat. Well, there is a cosmetic procedure. It's called Lipocel that can help to take the inches from your stomach, your back, your arms, your thighs.
All right, dermatologist and the owner of Image Dermatology in Montclair, New Jersey, Dr. Janine Downey is with us this morning to show us how the procedure is done. But explain to us, doctor, how this works.
Okay, so Lipocel is not like freezing the fat. Lipocel is a high-frequency ultrasound that actually uses thermal energy, and it bursts the fat cells apart. And once the fat cells are burst apart, you drink water, you exercise, the fat cells get pushed into your lymphatics, not into your bloodstream, and you pee some of them out, and you poop some of them out.
Oh.
It's totally safe. Works on males and females, all skin types, and people that, unfortunately, 70% of the American population is overweight or obese, or low. So basically, people need help to get their belly fat down.
Yeah.
You know?
I'm just wondering, if you need to lose weight, should you wait to have this procedure, or this will help you lose weight?
This can help some people lose weight if they have a BMI that's less than 30. If they have a BMI that's more than 30, we actually recommend that they lose the weight first to us, and it further spurs you along. And my patients are very excited about it. You want to see a demo?
Yeah, we want to see a demo, and I want you to tell me, because I've had M-Sculpt and True Sculpt. So tell me the difference between this.
Okay. Okay. So basically, there's a cooling contact right here. And what we're doing is we cool the area, so that way it's good for all skin types. And in the transducer, which is about this big, the ultrasound is focusing not on the skin, but on the fat below the surface of the skin. And it's bursting the fat cells apart. So that's why this is great for skin types if you're very light, if you're very dark, anybody in between.
What's it feel like, Janine?
What does it feel like right now? The patient's nodding her head like, nah, nothing. It can be a little pinchy towards the end, but it's completely tolerable. It's not heat, but it does work, and it's non-invasive. So there's not that, where the fat cells don't go away. This actually works, and it reduces pinches.
Great.
The majority of patients that's doing it 3 times can expect to see a minimum of 3 inches gone. As long as they're not too much.
Images from my colleague dermatologist. After 2 months, you can see here very dramatic improvement in the patient. If you treat any patient, sometimes you will encounter this kind of dramatic change in some of your patients. And after getting this image, I called him back and I told him that it's typographical error. 2 weeks after must be 2 months after. But he replied back, this is correct time. So what a surprise. After 2 weeks, can you even imagine, immediately after 2 weeks, can you imagine this kind of significant improvement in a very short time? And he replied the same way. What a surprise, but he really experienced this kind of patient.
Lipocel technology is pretty interesting, different, and unique. It is a high-frequency ultrasound that actually melts fat under the surface of the skin, and it is something that can be used in males and females in all ethnicities, and it can be used on young people and older people. It can be used on people that have this much fat or that have that much fat. The most common place I do the Lipocel is the abdomen. The second most common is the back. The third most common is the inner thighs. My patients really like the technology. For full results, typically we do a minimum of 3 treatment sessions, and then you'll see your best results about 8 to 12 weeks after. This is fun, interesting, and newer technology. It is not painful like the old ultrasound fat melting technology was, and it's something where patients can come, drive to the office, get the procedure, and drive back home again. The procedure itself, depending on where you have the fat and how much fat you have, takes roughly 35 minutes. Sometimes it can take almost a full hour.
Lipocel body sculpting is the latest treatment promising permanent fat reduction in sessions that take just 45 minutes.
So the way that Lipocel works, we use high-intensity focused ultrasound. We use a headpiece. This headpiece emits 30-second passes of energy, which will heat down to the subcutaneous layer, which will tighten the skin and melt the fat.
It's a completely pain-free procedure, so I feel great. I do go to the gym and try to eat very healthy, but there's just some stubborn areas that weren't shifting, so I thought I'd give it a go.
We recommend our clients do between 2 to 4 sessions. Each client will see some noticeable difference even after 1 session.
I saw results immediately after, but then over the next few weeks you can kind of see those results improving.